that I had to have it, but they'd pay me, they said. So I worked 3 months in the emergency room, but I wasn't that busy. I had a few come in for dressings to be changed and maybe some mild cut or something, but nothing great big.
Well, that you were lucky.
Yeah, I could have had gunshots and all that stuff, and I didn't have any of that. So I had really had an easy time.
What was your hardest rotation?
Trying to think. I know I liked surgery. We had to wash our own instruments and set the packs up for the next operation and sterilize them. We had to sterilize everything. And you scrubbed in on all the, well, not all of them, it's according to how many people was working. It could be somebody else be scrubbing too. Well, it's tending, being the doctor's helper. So we had to do that and wash the instruments after it was over and sterilize them. That was a lot of work to that, but it seemed like it was a routine. And you could just follow the same routine every time as far as things you had to do. When you worked with the doctor, you had to hand them their instruments, what they'd be needing next.
As a nurse,
Uh-huh.
and now there's
Technicians.
that do that. Nurses don't do that, do
Yeah.
they?
I think that's the way UK taught when UK opened up. The nurses would take maybe a period of time they'd come and work in their hospital at Central Baptist. But all they talked about is how to run the place. They never did any of the work. And that's the way they turned out. Seemed like they're just being instructed on how to be bosses and how to run the place instead of knowing how to do anything.
Did they turn out to be bosses?
Yeah, telling them how planning everything, how they wanted it. And when patients come up in labor hall, they'd just stand there and talk to each other. I'd go and meet the person. If I saw somebody coming through the door, I'd go meet them if I wasn't doing something in somebody else's room, that I wasn't outside. But they'd just stand there. They wouldn't offer to go get him, no matter how many patients I had. They may just had one or two, and I might have had 3 or 4. And I made an officer mad one day. I could tell it made her mad. She liked to sneak in her room and just have one patient. And she'd stay in that room so she wouldn't be out in the hall to have to greet anybody to put them to bed. I know that was her done. You could tell. And so I had already 3. And she just had that one patient, and everybody else had gone to lunch. Well, I was busy with those 3, and I knew she was in there by herself, so I went in and asked her. I said, "Can you take another patient? I've got 3." Boy, she gave me the dirtiest look I ever seen.
Did she take them?
She got up and took them because she couldn't very well say anything in front of the patient. I don't imagine. She took it, but you could tell she didn't like it one bit.
Nothing's changed.
Yeah, they just seem like they're just taught to be bosses and how to run stuff. And of course, they may have changed. That's the reason I think they've got you go through practical nursing first.
LPN,
Uh
like
Yeah.
how to be a nurse,
huh.
how to get your hands dirty.
And instead of going to UK as a girl, like they would be, they was just well, they was just business people. They weren't taking care of patients. I didn't have to give enemas and douches and all the stuff that we had to do. I used to do oral irrigations after, uh, this is way back, and they don't do it anymore. But Dr. Daly, he was took care of teeth. He would pull your teeth, but the nurses had to irrigate their mouth ever so often. Of course, they don't do that now, but they didn't, and of course, UK nurses didn't have none of that. Didn't have to give an enema in the mornings, douches. And it seemed like they never did have to catheterize, empty somebody's bladder. It's always getting somebody else to do it.